Healthcare workers in Barcelona have staged a rally in protest at their poor working conditions. Protesters are demanding greater job security and more recognition for risking their lives amid the coronavirus outbreak. Over 48,000 Spanish health workers have contracted COVID-19 since start of the outbreak in the country. Meanwhile, the country faces a deficit in its blood reserves due to the pandemic.
The blood reserves of the transfusion center are currently low. It happened that throughout the pandemic, hospitals lowered their activity, so there were only a few transfusions, and the same thing happened with donations. So it was not a problem because there was a balance. Once the hospitals began to regain normal activity, they began to need more blood, but citizens are still in a state of alarm. We are still confined. We cannot move freely, which means that there are fewer donations than what hospitals are demanding.
Now, officials have asked people to donate blood to alleviate the existing deficit. They say need for daily donations have nearly doubled compared to the peak of the pandemic. The Madrid Community Transfusion Center says it will send an SMS to blood donors, which they could show to police if they are stopped for flouting lockdown restrictions. And now back to one of our top stories, where in the UK, number of deaths attributed to the coronavirus has nearly tripled compared to Monday and rose to 627. Figure was the highest daily fatality since the 6th of May. Now, official data shows at least 20,000 of those died in the UK were staying in care homes. And joining us now to Bristol for more on the story is Tony Gosling, investigative journalist. Hello, Tony. Always a pleasure to have you on Press TV. Now, Tony, that's just that's a crazy number at the least, to say the least. 20,000 people have perished in care homes, and they weren't added to the national tally until just recently. Why?
Well, one of the main reasons is almost all of the care homes in Britain are in private hands. They're run for profit, if you can believe that. The idea is that, the people that own and run these homes do it for money, not about caring for people. That's not their top priority. The top priority is returning money for shareholders. Of course, this induces a serious problem in the way these places are managed, in that you're basically very nervous about saying that there are deaths in a care home, or that maybe one care home is not being run in a very efficient manner. We've had the same, actually, going on in our schools since the academy school system and the privatisation of schools. If a school has got lots of bullying going on, say, children being injured, some even killed at school, that school will do everything it can to cover up that fact. And so the profit motive, I'm afraid, is one of the reasons why care homes have simply not wanted the world to know what's going on inside. And from my own personal experience, I can tell you that the experience has been that now, as some people have for the first time been allowed into care homes, that is to say loved ones of relatives in those homes, they have found that a lot of understaffing and this sort of thing. So the temptation is on some of the more unscrupulous managers of these homes is to use it as an opportunity to get away with cutting costs within those homes, knowing that the relatives, loved ones and friends won't know anything about it.
And Tony, to jump on another aspect of this pandemic there in European soil, especially in your neck of the woods, Boris Johnson, obviously his government has gotten a lot of criticism the way they've handled this pandemic. But basically, I'm pretty sure right now you wouldn't want to be a world leader anywhere on, leading any country throughout this pandemic. I highly doubt anyone's going to get praised the way they're handling this. Is pretty unprecedented, at least in our generation and a couple generations before. But your objective interpretation of the way his administration has handled it thus far?
Well, okay, so there's a big problem with Boris. One is, of course, that he was hospitalised, but the government, I think, was bamboozled, to be honest with you, into accepting this very full-on lockdown where everything is locked right down. I don't think I would be ashamed to be a Swedish leader right now. I think the way that they've dealt with it is in a very measured way. Obviously, people are going to die, and some unscrupulous ones will be starting to point the fingers at leaders around the world. Some have pointed, I'm afraid, at President Xi, trying to blame him, Donald Trump, haven't you? And so in Sweden, what they've done is they've made sure, I think, that they've isolated the most vulnerable people in society. We didn't do that here in Britain. We isolated everybody, and that's been more problematic, really, because there's not a lot. And I can tell you, we've been relaxing the lockdown a little bit here in Britain. The advice is no longer stay at home; it's stay alert now. So there's a lot more people coming out. Just today, it happened to be quite sunny here. More people coming out of their homes because they believe that within social distancing rules, they don't have to be so locked down. In Sweden, though, they have made sure, by allowing the younger, less vulnerable people to catch this disease, that it's very, very unlikely that there will be any kind of big second wave of the disease once the limited lockdown is released in Sweden. So by protecting the more elderly people in Sweden, I think they've done a very good job in making sure that there's as little damage as possible. We in Britain, however, and in the United States and many other countries, are now going to have to cope with this second wave. As the lockdown is released, many more young people will be catching it. There's evidence, much evidence too, as well, that this COVID-19 was much more widespread in the West, particularly Britain, France, and the Alps, that in January and even possibly December 2019, before it was officially recognized as a pandemic, that many people caught it. I myself had a very, very bad flu back at the end of December, where I was hospitalized, no, but I was in bed for 3 days with a very high temperature, taking lots of aspirin, and I had a dry cough for nearly 2 weeks afterwards. I'd never have a cough like that. So I believe I could very well easily have had it, but I haven't been able to get tested, and I haven't been able to get an antibody test either. So there may be millions of people in Britain, France, and the United States who've had the disease but can't prove they've had it. Therefore, I would suggest that that's one of the reasons why Britain has made such a mess of this, is because they really didn't know what they were dealing with initially when they went into the lockdown. That's the main problem. And they had two ways they could have gone, and they decided, I think, on the wrong direction. In fact, just to prove what I'm saying, in Sweden, we've had the figures out recently. David Davis, the former Brexit secretary, Conservative MP, pointed out just a couple of days ago, he said, well, if Neil Ferguson, the government's advisor, if his predictions had come true for Sweden, not having their full-on lockdown, there would have been 15 times more deaths in Sweden than there actually happened. So obviously the Ferguson, Imperial College, and the models that they were working to in London when they decided on the full-on lockdown simply were not accurate, out by a factor of around about 15 times more deaths predicted than would have actually happened if they'd gone for a Swedish type lockdown.
All right, Tony, time has gotten the better of us, but thanks for joining us with your input there. Always a pleasure to have you on. Mr. Tony Gosling there, investigative journalist, joining us out of Bristol.